Greetings. My name is Michael Miner. I'm the National Director of the National Baptist Convention USA Incorporated Hope Health Ministry. And I welcome you today to this Midwinter Board Meeting Hope COVID-19 webinar. We do acknowledge our President of our convention, Dr. Jerry Young, our General Secretary, Dr. Alvin Edwards, the Chair of our Federal Faith-Based Initiative, Dr. Alvin Love, and of course to our entire Hope Health Ministry team and to all of you all, my National Baptist Convention brothers and sisters. We come to you today with a timely webinar. We know that as of this recording, it's been a year since the first case of COVID-19 came into our nation. Since that time, we're now at 400,000 people who have died because of this virus. So in today's webinar, we will have it in two parts. In part one, we'll look at the scientific aspects of the COVID-19 pandemic, with special emphasis on the efficacy of the vaccine. You know why it's so important for us to take the vaccine. In part two, we'll look at how congregations in the National Baptist Convention will be able to resume face-to-face worship. We know that throughout this webinar, if you have questions, feel free to type them in the chat and we'll do our best to respond. You may also email us at info@hopenbc.com, and you may find more information about our initiative and our COVID-19 efforts at our website, hopenbc.com. Now, let me introduce our first panelist. Our first panelist is Dr. Lavora Williams. She currently is the Associate Professor and Endowed Research Professor in Cancer Health Equity at the University of Kentucky School of Nursing. She is the Director of the Community Health Advocacy Interventions Generating Equity, it's called CHANGE team, and she's the Assistant Director for Cancer Health Equity at the NCI designated Markey Cancer Center, where she holds the Endowed Research Professorship in Cancer Health Equity. Dr. Williams received her undergraduate degrees in nursing from Union University and the Medical College of Georgia. She earned a Master's of Nursing as a family nurse practitioner from Georgia Southern University and a PhD in nursing with distinction from Georgia Regents University. Her research aims to advance health equity among racial, ethnic minority, and medically underserved populations through community-engaged research methods to affect improved diabetes, cardiovascular disease, and cancer outcome. She is nationally recognized for developing culturally adapted interventions for implementations by community health workers in church settings. She is a long-term member of the Good Hope Baptist Church in Augusta, Georgia, Pastor J.R. Hatney. And she has been part of our Hope team for the last decade and was involved with the NIH's outreach when they were doing the trials for the COVID-19 vaccine. Well, Dr. Williams, now we had all these introductions and the overview. Let me get to the biggest point of contention about Blacks and this COVID-19 vaccine.
Okay.
I've heard many Black people indicate that they're hesitant about taking this vaccine. They're not going to take the shot. All right. And you know what? And those that are going to take it, they said, look, I'm going to wait and see what happens to other folks who've taken it. And I still might not take it. This is what I'm hearing. Now, and then some of them said they're not going to take it at all. Well, were there Blacks involved in these trials?
Wow, you know, that's a packed question that you just gave me. So let me try to unpack that. So to address the first part of your question about people are going to wait and let other people take it and then they're going to take it. Well, lots of people have already taken it. I mean, about 200,000 people per day are receiving the vaccine right now in America. And that doesn't even count the people in other countries who are taking the vaccine. And the clinical trials, before it even became a vaccine for use, included tens of thousands of people before the emergency use approval was given. So people have already taken it. So people have already gone ahead of you, so to say. But then regarding vaccine hesitancy, yeah, a lot of people are hesitant about taking the vaccine, and particularly people of color are hesitant. And over the last few months, I've been exploring that with my own research, just getting groups of Black people together to ask them what are their concerns regarding the vaccine. And what we're hoping to do with this research is to develop some messaging that will help answer the concerns that people have about the vaccine. So the concerns that I've had and heard is that, well, and had, let's just face it, I've had the same concerns,
Right. All
is
right.
they're concerned about the safety. They're concerned about the quickness of the development of the vaccine, and they're concerned about the government's influence on the approval process. Despite these concerns, about 10 to 18% of the clinical trial participants were Black people.
Hmm.
Now, that number is okay, but it's certainly not at the level that we would like to have involved in any clinical trial, because the more diverse the clinical trial participants, the more stronger the evidence to say that yes, this vaccine was tested across all people, all ages, all medical conditions, all races, ethnicities, etc. And then that gives more credence to the evidence and gives more evidence regarding the safety of the vaccine itself. Now, because Blacks and other people of color have been severely impacted by COVID-19, there's been a lot of effort to really get them involved in the clinical trials as well as now into the vaccines. So we had a vaccine clinical trial at the University of Kentucky. As you know, that's where I work. And my role in that was getting together focus groups before we even started trying to recruit, getting focus groups together to ask people, what did they think about the recruitment material? What kind of messages did we need to include on that material to get them interested and overcome their concerns about the safety of participating in the clinical trial? I think that the more we involve our research participants up front, before we try to get them to engage in clinical trials, the more opportunity we're given to develop trust with them. And as you know, that's lacking among people of color.
Well, you kind of got me thinking. You talking about this vaccine, the preparation. It was done quickly. I mean, come on now. Like February, March, we get the first case, and then around November, we get the vaccine. Now, come on now. You're a good national Baptist. Tell us the truth. Were there any corners cut in getting this vaccine to us?
No, 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 absolutely. Um, Dr. Miner, there was no time to waste in the production of this vaccine. We needed it. I mean, it's a international, global pandemic. In
Mhm.
fact, one person is dying every minute from COVID-19. And unfortunately, those numbers are rising. We watch the news, we hear it every day, how the numbers are not getting better. And so not only are these people dying, Dr. Miner, they're dying alone,
Mm.
holding the hands of a nurse or a physician, which is very compassionate, but yet it's not like dying surrounded by their family. And as you know, that a lot of these people who are dying,
Mhm.
they look like me and you. So yes, the entire vaccine process was faster than usual, but I assure you there were no shortcuts taken. And we can talk about the reasons how they were able to develop that vaccine as quickly as they did. So one of the main reasons is that scientific tools are just better. So for instance, vaccine production, it begins with research on the genetic makeup of that virus. So where it used to take months just to read or code, genetic coding of a vaccine, now of a virus that is, now it just takes days. Secondly, the process of vaccine production is not new. So scientists have worked for years to develop a platform. And so this platform or model, it's used for different viruses. So because this platform that was used, which was the messenger RNA or mRNA, as the delivery tool, what it does is it teaches the body how to recognize as well as fight a new virus.
Hmm.
So the pharmaceutical companies, Pfizer and Moderna, they were already working on developing this platform. So it was like ready. So then a third thing is that it was a global pandemic. So a lot of times what happens is scientists, we get in our own little labs and we work with our own little lab group and we don't share the information that we're discovering in our labs. But with this, because it was a global pandemic, the greatest minds got together and they decided how they were going to design these clinical trials so that the protocols were similar. And as information was learned, it was shared. And another big difference in that really helped get the vaccine produced faster is that the government agreed to pay for the vaccine companies to produce a large amount of these vaccines while they were still in development. So that when one was discovered to be number one, safe, and number two, effective, they were already ready to distribute it to different countries, such as what they're doing now. And lastly, because the vaccine affected everyone, people were willing to participate in the clinical trials because they had been impacted by the virus. And unfortunately, but fortunate for the scientists, is that because the pandemic was so out of control, people, the trial participants, as they went out into the community, they were getting exposed to the virus. And so what that did was that provided information to the scientists about whether those people who had received the clinical trial vaccine, whether they got sick or not. And lastly, we have to talk about safety. So every clinical trial has an independent data and safety monitoring board that reviews the effectiveness as well as the safety data. And what that means is that the scientists or people who review that, they're not the people who are working on it. They're the people who have the expertise to evaluate the data, but not the people who might be biased in looking at it. And so even when the vaccine was reviewed by the Federal Drug Administration, they also had an independent panel of reviewers to look at it before they made that approval. Now, even after we get the vaccine, the CDC is still monitoring what happens to people because, yeah, it's a new vaccine. So the CDC, when you go in to get your vaccine, you're going to have an opportunity to participate in the CDC trial. So it's a simple app. Well, it's not an app. You scan it, and then you get a survey. So every day, the CDC will contact you and say, hey, how are you feeling? What symptoms are you having? And based on your answers, they may even call you. But what they're trying to do is get some information about the long-term safety and effectiveness of the virus beyond the months that it took for a clinical trial to get approved. Does
Wow,
that
that
make
I
sense?
didn't know. Wow, good.
Yeah, yeah.
Well,
A
now
lot goes into it.
I know. I'm hoping that our National Baptist family is grabbing a hold of this. And
Yeah.
speaking of our National Baptist family, let me go here. Okay. Now we're in our midwinter board meeting. What
Okay.
can you say to them, to the people who are still, after all this good conversation we've had here, are still hesitant about taking this vaccine?
Well, there's a reason to be hesitant, Dr. Miner. We know, history of people of color and research hasn't always been positive. So there's a mistrust about researchers and about how people are involved, are treated by researchers. So we know about Tuskegee and other trials, but now there are safeguards in place. And those safeguards are called institutional review boards, as well as data safety monitoring boards that I discussed previously. And what they do is they make sure that the public is protected against research misconduct. So although the concerns that people have about the vaccines are valid, and we should listen when people share those concerns with us, um, the data about COVID-19 and how it's impacting Black people, how we're being infected and how we're dying at higher rates, it's alarming. So because of that, we have to overcome our mistrust. Black people are infected at 1.5 times the rate of others. 22% of COVID-19 cases are Black people, and we only make up 13% of the national population.
Wow.
And then the people who die from COVID-19, Black people are 3 times more likely to die than others. So we really can't afford to let fear dictate our being a part of stopping this pandemic and stopping this senseless loss of lives when we have science that has a vaccine here for us. So I would just suggest to people to arm themselves with knowledge. The more we know about something, the more we develop trust in it. And there's really no reason for people to believe myths and stories or misinformation about these vaccines because there are so many reputable websites. And I'm sure you're going to share some of them
Oh, yes, by all means.
today,
Mhm.
such as the CDC, such as the Pfizer and Moderna websites, where we can go on and we can learn everything there is to know about these vaccines. These websites even list the ingredients of the vaccines. So when we're hearing things about, oh, it's got formaldehyde in it, or it
Mhm.
has chips where they
Right.
can track you, we can arm ourselves with knowledge. And another thing that we can do is we can talk to our healthcare providers
Hmm.
because we might not trust scientists or researchers, but surely we have a nurse practitioner, physician that we trust, and we should ask them their thoughts about whether the vaccine is safe and whether it's effective or not. And Dr. Mine, I just have to say it, we're Christians.
Oh,
So we just can't allow ourselves to perish over lack of knowledge. And we really have to conquer our fears with our faith because this vaccine is here. And although we may not trust in it, we've been impacted by it.
true.
We've seen people in our churches and our families and communities be infected and even die from COVID
That's
19.
that's true. Okay. Well, now you're talking all this good talk. So here it is. I hope you're ready for this question. Dr. Williams, have you taken the vaccine yourself?
Oh, wow. Yes, I've taken the vaccine, Dr. Miner. I've taken the first dose. I took my first dose just the day before yesterday.
Oh,
I
okay.
took the Pfizer vaccine. And
Okay.
as you know, that Moderna and Pfizer vaccines,
Hmm.
they both require 2 doses, and those doses are 21 days apart. And when the vaccine was first approved, I was hesitant myself, but I went through the same process that I just advise others to do is, arm myself with knowledge and have faith that, God would not provide scientists with the wisdom and knowledge to make this vaccine and that somehow it would harm us in some way. And then, I just armed myself with that. And so I think that it's especially important for Black people who are dying at higher rates than others to consider learning more about it, trust the science. And for me personally, I miss my family. We've had new babies being born that I've been afraid to go visit because, God forbid that I would harm them. So I want to get back to enjoying life. And I want to get back to the new normal that we've previously discussed, where I can go to church, dine out, go to concerts, and gather with my family and friends again.
Well, all right. So then, okay, everybody, let's get this. She has taken the vaccine. So now we can see she still is in one piece, but I still got to ask this question. What are the common side effects that people can expect, and did you have any from this vaccine?
Okay, so to address some of the concerns I've had, it's not a live virus, so it cannot give you the coronavirus if you take
Oh,
it. So what it does is it wakes up the immune system and it teaches your body to recognize a protein that's in the coronavirus. So what are the side effects? So arm pain, just like any shot, the arm that you get it in might be sore. I recommend that people take it in their dominant arm because some of that soreness comes from um, just protecting the arm close to our bodies. So you want to put it in your dominant arm because you're going to use that arm more. Another side effect, and the data tells us that most of the side effects occur after the second dose. So they are headache,
okay.
muscle aches, um, feeling fatigued or tired, fever, chills, and some nausea. It usually happens about 1 to 3 days after the second dose, and sometimes after the first dose, but more commonly after the second. And it usually resolves just as quickly within 1 to 3 days. Now, if you take the vaccine and your symptoms are not mild, then it could be that you were exposed to the coronavirus before you took the vaccine, but
Oh,
you just didn't have any symptoms yet. So if you become sick, you should seek treatment. Don't think that, oh, it's the vaccine causing it. The side effects of the vaccine are mild. So if you get sick after the vaccine, then you should seek treatment. So after you take the vaccine, they're going to monitor you for 15 minutes just to make sure that you don't have any immediate side effects. And if you have a history of severe allergies or if you've ever had an allergic reaction to a vaccine, then let the provider know and they will monitor you closely for 30 minutes immediately after you get your vaccine.
all right. So that's short-term effects. What about the long-term effects of taking the
Hmm.
shot? Mhm.
Well, keep in mind that no one has had the vaccine in their body for more than 9 months because the clinical trials, the earliest one, started about 9 months ago. So honestly, we don't know what the long-term effects of the vaccine are. Only time is going to tell us that. And so far, though, there have been no reports of possible long-term effects. But meanwhile, there are long-term effects of COVID-19 infection. So we've been hearing that in addition to it killing lots of people every day,
Yes.
that it's also causing some long-term symptoms and disability
Oh,
from
yeah.
people who've had the infection. So they may have survived, but they're having long-term effects of having had the infection. So with that being said, we more time will tell us the long-term effects of the vaccine, but there's no reason for us to think that the long-term effects are going to be detrimental to our health in any way.
I know because I've had about one-third of our congregations have had it, and the long haulers have talked about some of those long-term things. So I would definitely can
Oh,
relate to what
wow.
you just said. All right.
Yeah.
Well. So you're stirring me up again here with something else. You talked about the people that are allergic to it like this,
Mhm.
but are there some people who, for whatever reason, should not take the vaccine?
Well, right now, um, the contradictions of taking it are people who are less than 16 for the Pfizer vaccine. And that's only because the Pfizer trial enrolled people ages 16 and above. And for the Moderna vaccine, 18. and above can take the vaccine. A person who's had a history of a severe allergic reaction to the first dose of the vaccine should not take the second dose.
That's
A person who's pregnant or planning pregnancy and breastfeeding women, they can take the vaccine, but they should discuss it with their healthcare provider because there's a benefit of their taking it because we know that people who are pregnant oftentimes will get a serious COVID-19 infection and they have a higher risk of losing their pregnancy. But they need to have that discussion with their healthcare provider. Right now, there is no contraindication to their taking the vaccine, though.
all right. Well, I'm going to ask another crazy question here. Some of the people say, well, if I just wait to let people take the vaccine and other folks get sick from COVID-19, then I don't have to worry about taking it at all. Is that true?
It could be true, Dr. Meinever. We don't know yet. Now, what they're talking about is herd immunity, meaning that so many other people have taken it and
Oh,
or had the infection, so they're immune, so they kind of protect me because the numbers are lower. The number of people infected are lower.
okay.
But we don't know that that's going to be the case with
Oh,
COVID-19 because number one, the number of people needed to be infected, to be protected, immune, so to say, to protect other people who are not immune, it varies per virus. And we don't know what that number is for the coronavirus.
okay.
So we're a long way away from knowing about herd immunity or
Mhm.
wait till millions of people are vaccinated and immune, and so I don't have to. We're a long way away from that. But right now, um, we're in the middle of a pandemic where people are dying. So that information we do have.
All right. So all of you all that are trying to wait, don't wait. Get vaccinated. You heard it here. All right. Well, let's talk about this new normal. I see people so
Mm.
excited they got the shot. So that means once I take this shot, well, I'm gonna go a step further. I've taken the first one and the second one. Then I guess then I can quit my social distancing. I can ditch my mask and everything. It's back to normal. Is that what that means? Take the shot? Talk to me.
Unfortunately, no. So we know that the vaccine decreases the risk of getting the the virus by 94 to 95%. We know that. But that's not 100%. So it doesn't offer 100%. It's not guaranteed,
Oh,
but it's pretty high. 94, 95%. That's very high.
okay.
And we don't know that if a person has had the vaccine, if whether they can still be an asymptomatic carrier.
Ah,
So we still need to wear a mask.
okay.
We still need to wash hands. We still need to social distance.
Oh man.
um, and then what will happen is we need to learn a whole lot more. And as public health officials learn more, what they will do is start slowly reducing those restrictions.
Gotcha.
And then they will closely watch the infection rates to see if they're starting to rise again.
Okay, gotcha. Well, what about a person who's already had the virus? Do they need to take the vaccine?
Well, there's a lack of information about that too.
Okay.
So we know that, well, the data has shown that after a person is infected with COVID-19, with coronavirus, that they are immune for maybe 90 days.
Hmm.
And so we know 90 days, maybe. And that's varies by individuals. So what that means is for those people who have had an infection within 90 days, they can have a discussion with their healthcare provider
Okay.
about perhaps waiting 90 days to let other people get the vaccine first, and then they get their vaccine. They can have that conversation with their healthcare provider, but we really don't know the length of immunity after the vaccine or even after infection. Data suggests at least 90 days, but we need more data.
Okay. Well, speaking about that new data, what about this new variant that we've been hearing that's out?
Oh,
Everything. Well,
yeah.
this we've been hearing stories that maybe the vaccine that's out won't be that effective against it.
Well, we hadn't talked about it much in our discussion today, but the vaccine works by teaching the body to recognize the spike. We've all seen those pictures of the coronavirus, and it has all these spikes on it.
Yeah.
So, what the vaccine does is it teaches the body to recognize a protein on those spikes. So, the mutation or the variant that we're learning about, it might have a different protein, but just because that variant might have a different protein spike, it doesn't mean that the vaccine won't recognize the other spikes on the virus. So, thus far, Pfizer has already reported that their vaccine covers the current mutations. Moderna hasn't reported that as of yet. However, the Pfizer and the Moderna vaccines both use the same technology regarding the mRNA that I previously discussed. So we can expect the Moderna to offer equal effectiveness in these mutations that we're learning about, as well as the Pfizer vaccine.
Okay. All right. That sounds great. Now, for the next thing, we hear people that are jumping on planes, flying down to Florida, trying to lie about their age, say that they're 95 so they can get the vaccine. So, look, talk to us. When will the vaccine be available for everybody?
Okay, so right now, because the distribution, um, who gets the vaccine, it's really based on two things. Number one, a person's risk of being exposed to COVID-19 at work or where they live. And number two, a person's risk for getting seriously ill or dying from COVID-19 because of their age or some underlying medical condition. So, according to the CDC, based on vaccine production, it's probably going to be available for everyone in the early spring or early summer, but we're uncertain yet.
Okay. So, we just got to let the song. We got to hold on. Okay.
Just hold on. Yes, hold on.
Keep wearing that mask. Okay. All right. Well, look, we haven't talked a whole lot about the flu this year. Haven't heard very much about it. So, do we still need to take our flu shot?
Oh, yeah, absolutely. We need to take our flu shot because the symptoms of the coronavirus and the flu, oftentimes they are similar.
Okay.
So a person might have the flu or they might have coronavirus, we're unsure. But if a person comes in with symptoms and they say, well, you know what, I took the flu vaccine, then it's more likely that we can start treatment for coronavirus if they're seriously ill. Another thing is that we would hate for a person to have the flu and coronavirus at the same time.
Oh my
That would be
God.
devastating.
Wow.
And as well, it would be devastating to the individual, as well as devastating to the overburdened healthcare system. I
Wow.
mean, it's already overburdened.
Okay. All right. Well, look, you jogged me again here with this. So we got to take the flu. We're asked to take the flu shot every year. Well, will we have to take the COVID-19 vaccine every year too?
Well, the short answer is we don't know because we don't have enough data. The the virus is new, the vaccine is new,
Okay.
so we need to learn more.
Okay.
Um, you know that the flu vaccine is fine tuned every year. And that kind of addresses the concern that you had a moment ago, the question you asked about the mutation and the variant. So we know that the flu vaccine it changes each year. That's why everyone has to be vaccinated each year. So maybe we'll have to take the coronavirus, the COVID-19 vaccine yearly. But the short answer is we don't know. I mean, it's only been 9 or 10 months since someone's been vaccinated, so we don't know how long the immunity will last from the vaccine.
Okay. All right. We both was a good National Baptist, and I want you to know I've heard from pastors from all across the country, and they're excited because the vaccine is out. And so now they're looking to go back face to face. They're already making plans. So as churches are considering reopening, will you talk about the effectiveness of the vaccine and what exactly is it effective against?
Well, I'm excited too about church reopening or the day that that comes. But to answer your question, the vaccine was 94 to 95% effective. And what it does is it's effective against slowing the chances of getting infected with the virus, as well as dying from the virus if a person is infected. So what this means is that the people who receive the vaccine versus the people who receive the placebo, people call it the sugar, uh, the placebo, they were less likely to die or become infected with coronavirus compared to the people who received the placebo. But again, I said it was 95% effective, not 100% effective. So we don't take the vaccine and then just throw away our mask and start gathering at church and with our family and friends. So the vaccine is just part of the solution to stopping the spread of this pandemic. So we still need to wash our hands for 20 seconds. We still need to wear a mask, and we still need to social distance.
Okay.
And we still need to stay home when we're sick.
Okay. I know. At our congregation, we're starting to sniffle, stay at home.
Exactly.
All right. Well, look, wow. The time just flew. We've covered a lot of ground today. But look, I just want to make sure, is there anything else that you'd like to add before we conclude?
No, Dr. Miner, I think that we covered the most common concerns that people have regarding the vaccine.
Okay.
So no, I don't have anything else to add.
All right. Well, thank you so much, Dr. Williams, or as I call her all, thanks to Dr. Lavora, for enlightening us today. Well, we're so blessed in the National Baptist Convention to have people like yourself that for us, by us, who are involved, that are part of our church. Give a shout. Make sure you holler at your pastor and tell him that we're excited that you're one of his members.
A shout out to Dr. J.R. Hatney and the Good Hope Missionary Baptist Church of Augusta, Georgia. And Dr. Miner, I am just so happy to be a part of this organization.
All right. Look, everybody, the Vice President of the United States is from a National Baptist Church, and one of our leading people talking about this vaccine is from it too. Look how the Lord blessing us. All right, everybody. We thank you again, Dr. Williams. Okay, look, everybody. If you want to get more information about what we're doing here, you can go to our website, which is hopenbc.com. We're going to get ready now to go to the second part of our session. Dr. Lavora, just say one good last bye-bye.
Bye.
All right. And we are now preparing to go into the second part of our conversation today. Now to introduce our panelists for part 2 of today's webinar. First, we have Reverend Dr. Gary Levy. He was installed as the 5th president of the General Baptist State Convention of Wisconsin in October 2011. He is currently serving his 2nd term as the convention president. President Levy has been the pastor of the True Love Missionary Baptist Church in Milwaukee, Wisconsin since April 1st, 2006. He is a man with an humble spirit and a strong relationship with God, and believes highly in the importance of the church being involved in community outreach and community uplift. Our second panelist is his wife, Dr. Desi Levy. She is an assistant professor at the Medical College of Wisconsin, and she's also the assistant director of Clinical and Translational Science Institute of Southeast Wisconsin. She co-leads community engagement initiatives and integrating special populations in the area of translational science and research. She has been a prime researcher in several NIH-funded research opportunities. She has a consistent team science funding record involving Black and Brown communities. Current research efforts and interests have also included nursing interventional clinics and faith communities focused on the mitigation efforts of COVID-19. She is an active member of the NIH All of Us Research Program Wisconsin Consortium Initiative. And she is a member of our Hope Health Ministry team. Well, in part 1 of our panel discussion, Dr. Williams shared about the efficacy of taking the COVID-19 vaccine and the need for continued safety practices. With the expectation for significant numbers of Americans vaccinated over the next 100 days, Dr. Levy, from a safety perspective, what would you say to our National Baptist Convention, state convention presidents, and pastors like your husband who see mass vaccinations as an opportunity to resume face-to-face gatherings, especially Sunday worship?
Thank you, Dr. Miner. Through what we are anticipating making a significant difference and strides with the vaccinations of Americans is still not the opportunity for us to go back to the way that we were. What I mean by that, until we have seen a significant decline in the deaths and the positive cases across the country, we must all continue to practice the 3 W's. And I'll talk about that a little bit later, and I'm quite sure Dr. Labor Williams has spoken about that. The vaccination does not give us a green light to say, I can't get COVID, nor does it getting the vaccination prevent us from getting the virus or variant of the virus. So I just received my vaccination on this past Friday.
Awesome.
The first step of the vaccination, because of course I'm an essential worker. And then I'm scheduled for my second part of the vaccination on the 5th, which you have to have them so far behind. But we are still given the instructions on yesterday, or Friday, should I say, when I received my vaccination, to make sure that I wear my mask, I practice safe hand washing, as well as social distancing.
All right. Well, since you're giving us those things about the things we should do, what are some ways that National Baptist congregations can help the Biden administration's mass vaccination initiative that we just heard announced?
Well, we must first, as a body of people, learn what the Biden administration is putting forth, and then do the research after it about so we can make conscious decisions on our participation. I don't think that just saying I'm not gonna take the shot, I don't know what's in the shot. There's a lot of things that we consume, both medically and non-medically, that we don't know what's in them. And so I to take the hold of understanding what the new administration is welcoming and offering to us still stands. We don't know that our president-elect, and what we do know is that our president-elect, Joe Biden, and his vice president, Kamala Harris, have made a commitment to following the science and making that they understand what the experts are putting out there versus making just a political decision and taking a stance from that perspective.
All right, great, excellent. And we'll also keep information posted on our Hope Facebook and web pages. Thank you. All right, President Levy. All right. I understand that the churches in your state convention, including yours, are making plans to resume face-to-face worship. Would you share the process you all are undertaking to make this decision? And what is the tentative time frame for this to happen?
Yes, thank you, Dr. Miner, for this opportunity. Yeah, we do have some churches that have begun to come back face-to-face in their worship. And of course, they are facing some challenges. Overall, the churches in our convention are undertaking this process by having an ongoing educational discussion about the COVID-19, which started last year at the beginning of the pandemic. However, we have partnered with the Medical College of Wisconsin, Council of Faith, which is all denominational, the CTSI, the discussion of faith and the research, the module leaders, and the Wisconsin Department of Health Services, the city of Milwaukee, health department and our mayor to accurate guidelines and provide our pastors for, convening face to face for worship service following the guidelines. So we do want to make sure that we are in tune with what is being said. Again, oftentimes we hear Dr. Young say, follow the science, our president. So again, we are trying to follow the science and just be, governed by the Holy Spirit.
Okay. All right. Well, Dr. Levy, you're blessed. Your wife is in the medical field. So how has your wife's expertise helped in this decision-making process?
Amen. Praise the Lord. Well, we are truly blessed and I'm thankful. Her faith, first of all, demonstrates that. This is my wife's profession. She has been a healthcare provider for over 30 some years. Dr. Leva has established herself to be a trusted expert through her experience in the, epidemiology, and public health, even while sitting at tables where she's not wanted. She does this work, and if she feels that the answer may not be suffice to your hearing, she will seek more information on behalf of, her colleagues.
All right. And wow, 30 years? Wow, she doesn't look a day over 25. Okay.
Yeah, I keep it that way.
All right. So, President Levy, now look, some pastors now, they've expressed some hesitancy about returning to face-to-face worship. And the reason why they're concerned about liability associated with somebody contracted COVID-19 from a face-to-face worship. All right, now, how would you address these concerns?
Amen. Well, at this point, there's active legislation being discussed as we speak. The Senate expect to consider churches' liability as they draft their next COVID-19 relief bill. Key leaders have already discouraged the COVID related lawsuit against businesses, hospitals, schools, houses of worship is the right thing to do. So we pray that people will follow the guideline we have put forth, and we should be held accountable for, non-compliance of others. So according to, as they enter back in, we just have to hold individual accountable. We can't force them to do anything, but again, just like with, even with the guns, the problem that we have with our guns, we have the signs on our doors, guns are not welcome. So we have to really push forth this effort in regards to the COVID-19.
All right, so it's all about some personal responsibility.
Personal responsibility, yes.
Now, to both of you all, and we'll begin with Dr. Levy, how has your medical research, spiritual calling backgrounds been beneficial and maybe not so beneficial in making decisions about face-to-face worship? Dr. Levy?
Thank you, Dr. Miner. Again, I think being on this journey for over 30, it's actually been 35 years, that I feel has truly been a blessing for me. My first call is being born again and taking the gospel of Christ and the teachings of Christ throughout every journey and chapter of our lives that we have. So I'm truly grateful for that. And so as I continue advancing my professional career, especially in the area of science, I'm oftentimes questioned by colleagues that, scrutinize our faith and scrutinize our religion, type of thing. And so I move by way of the Holy Spirit in making these conscious decisions as it relates to trying to intertwine my faith with science. I just told someone yesterday that God created us. It's no such thing as evolution. And we had a really detailed conversation as scientists, and he too is a born again believer. As it relates to the mission, of this coronavirus and the work that we have to do is huge, and we are not moving forward without including God, Jesus, the Holy Spirit in this work.
Again, as has been stated, Dr. Minor, we are trusting God. Our spiritual background outweigh everything else. We trust that God will lead us and guide us in the decision making that that need to be made. He said, God Himself said that He would be with us even until the end of the world, and our faith must be grounded in Him. So again, being a man of God's word, we must trust that God will lead us and guide us through this, and just be governed by the Holy Spirit, listening to the scientists such as my wife, Dr. Levy, individuals like you and our leadership team. So we're just going to trust God, and He will see us through it.
Excellent, excellent. All right. And look, is there anything else that you like to cover before we close today?
One of the things I do want to just reiterate, I know Dr. Williams spoke to it as well, and I mentioned it at the opening of this part of our presentation. We want to make sure that as we try to reconvene, some churches have, and those that are following and taking a little bit slower pace, we still have some mutual action steps that we have to make sure that they're in place. One is promoting the healthy hygiene, meaning making sure that we are washing our hands for the 20 seconds at least every time we have a chance to do that. And many may have asked and or practiced hand sanitizing. Just let me reassure you that hand sanitizing is a supplement to hand washing. Hand sanitizing is good when you don't have access to soap and water. So please, sir, please, ma'am, make sure that our pastors, the associate ministers, everybody in our pulpit have access to hand sanitizer, but quickly having access to hand washing. The other step, of course, is wearing our face mask. I do want to put in a plug for face masks, wearing them appropriately. To wear a face mask that is securely placed on your face, around your mouth, like Dr. Minor has. And then we also have ours as well from our national project with the All of Us, that I'm gonna use the husband as an example because I don't want to cover my mouth. But make sure that you have it over your nose and that there's a touching point underneath each of your eyes and that it goes under your chin. Even for men that have facial hair, it should be there under your chin. The reason being is, again, the particles of the coronavirus are so minuscule that they can seep through certain types of masks. And you want to make sure that your mask, to test it, just hold up your phone. You can use your flashlight on your phone, put it through, and you don't want to be able to see the light like such, but you want to be able to see the littlest of light possible, and that's how you know that you have a sufficient face mask. Also, in terms of social distancing, and this is an application that comes along with reopening as well, your pews should be arranged so that individuals know that they're seated at least on the minimal size, 6 feet apart. We talk about sitting based on a body length in those pews. One of the strategies that we're employing at our edifice is we're going to try to seat families that worship together versus if you're not part of my household, sitting you on the same bench. You may ask and talk about, we're going into grocery stores, we're going into shopping centers and places like that, coming in contact with individuals. But the catch there is that, are you in contact with those individuals for 15 minutes or more? Any healthcare institution that you walk into, they're looking at a 15-minute time window for your exposure. The other thing I think is important is when you open your edifice, a lot of churches went and invested in super duper cleaning services, when in essence, most churches have a cleaning ministry, and they were closed down for a substantial period of time. So guess what? That substantial period of time actually worked out to the benefit in terms of our edifices being safe and clean. Now, there is a to wipe down when you resume your services, touch all of those heavy touch surfaces, but you also have to take it to the next level of disinfecting. There's a difference in cleaning with soap and water versus disinfecting. Your disinfecting solutions need to be at least something of industrial quality, like the Lysol spray, the Clorox wipes, and things of that nature suffices. You're talking about wiping down your hard touch surfaces. If you still have wood pews in your sanctuary, wiping those down so that it doesn't damage the wood, the beauty of the wood, the microphone podium where our under shepherds are mounting every week. I want to highly, highly encourage all of the pastors, if you already have it, make sure you have an independent mic of everybody that's on your DIs. If you can afford to have a mic for each person, the best way to go, because again, that's a device that's closely held, and those particles hover in the head of that mic, if it's a headphone that's shared or whatever, but try to individualize it. If you're at a not fiscally stable overseeing a congregation that can't afford to invest, they have some mic covers that you can slip on and off and drop into the trash. So those are just some key points that I really wanted to make sure that's probably already being practiced, but we just want to positively reiterate for our under shepherds, for our congregations, and for, you know, God's kingdom, because he gave us 5 senses, and we're supposed to be able to use those 5 senses. So if you have any questions, the CDC is the most highly accurate resource out there that actually connects with institutions like where I work at the Medical College of Wisconsin, Johns Hopkins University, the University of Southern California Health Systems. Log on to CDC and see the faith-based guidelines. And lastly, I just want to make sure that everyone knows that that link at the CDC connects with not only the CDC, but institutions like the Medical College of Wisconsin, where I work, along with the Johns Hopkins University, all of the prestigious organizations that has accurate information. Make sure that you connect with your federal, your state officials, and your local officials, meaning your mayor and your public health departments. So to that end, praying God's healthiness and safety upon all of my brothers and sisters through the end of this COVID.
All right. Well, thank you all, Dr. Gary, President Dr. Gary, and Dr. Desi Levy. Thank you all. And then as a personal matter of privilege, we do thank God for how he is blessing President Levy. He's had some health challenges and whatnot, but he still got that smile. Now, he also jokes that his smile not only because of his health, but also because he has such a wonderful wife. So whichever way you want to go with it and whatnot, we're fine. And we thank you all. All right.
You're the handsomest president I've ever seen.
God bless you. God bless you. Thank you so much. Thank you so much.
All right.
God bless.
All right. We covered a lot of ground in today's webinar. In part 1, Dr. Lavora Williams, who, by the way, is a member of a National Baptist Convention USA Incorporated congregation and a researcher, shared about the importance of us taking that COVID-19 vaccine. She also reminded us that just taking the vaccine doesn't mean we need to drop our guard. We still got to wear our mask. We still have to practice social distancing. In part two, President Gary Levy and Dr. Desi Levy shared with us practical aspects for those churches that are considering going back, resuming face-to-face worship. And we noticed throughout everything they were saying, it's important for everybody to take on personal responsibility. We know that you will probably have additional questions, concerns that you might want to ask or share with one of our panelists. Again, you can email us at info@hopenbc.com or go to our website, hopenbc.com, and we'll be more than happy to answer your question. We also want to remind you as we close about our newest initiative, the All of Us initiative through the National Institutes of Health. You can learn more about that information by going to our website, hopenbc.com, or joinallofus.org/together, where we are working with NIH to enroll 1 million or more people in research. And the All of Us research program is on the front lines in acquiring information about how people are progressing in this pandemic environment. So we certainly hope that you will learn more information and participate in this effort. And as we close today, I'll slide over and finally remember, pray, take precautions, it's not over, and more importantly, think about others. Again, I'm Michael Miner, the chair of our National Baptist Convention USA Incorporated Hope Health Initiative. And on behalf of our president, Dr. Jerry Young, and all of us that are part of this convention, we thank you so much for joining us today. God bless you. God keep you.